Gout is a disease that has confidently outpaced stroke in terms of spread rate in our time. After all, over the past 27 years, gout has been diagnosed 5.5% more frequently worldwide. And the number of years of life lost due to gout has grown even more. Doctors are seriously concerned. The world is currently experiencing a new epidemic of gout. It's possible that you might find yourself in a rheumatologist's office. Or perhaps you're already battling this disease, which is a form of arthritis, meaning an inflammatory joint condition. In Greek, gout translates to a trap for the foot. And that's accurate. During an attack, the person experiences excruciating pain that grips and doesn't let go of the foot for several hours. The source of this unbearable pain is the inflamed joint, and the cause of the inflammation is the deposition of uric acid salts. The big toe is primarily affected. That's where uric acid tends to accumulate most often. However, it can also be deposited in the joints of other toes, in the knees, elbows, wrists, and ankles. So gout can occur anywhere in the body where uric acid accumulates. But why does this happen? Where does the excess uric acid in the body come from? Rheumatologists believe it's due to an improper diet rich in meat and wine. So, is the swollen toe, too painful to touch, really a consequence of diet? Could it be that people are causing gout themselves through what they eat? Let's delve into this. Today, you'll learn what purines are and why they're necessary. Can you die from gout? And is it true that gout leads to a stroke? What mistakes are made in gout treatment? Are kidney problems a result or a cause of gout? Can bunions lead to gout? How to distinguish gout from pseudo-gout? How to relieve inflammation and pain? And most importantly, you'll learn about treatments that actually work. Let's begin. You already know that gout occurs when there's too much uric acid in the body. In other words, the disease is related to metabolic disorders. It's a case of if something arrived somewhere, it means something left somewhere else. Many don't realize that uric acid is necessary. It protects cells from oxidation. But if there's too much of it, it becomes harmful. Normally, the kidneys filter the blood, removing excess uric acid from the body. But if too much is produced, the kidneys can't cope. Uric acid isn't properly excreted, and there's an excess of it. With nowhere to go, the excess uric acid settles in the joint of the big toe. Why there specifically? Feet are particularly vulnerable because they're colder than other parts of the body. Moreover, the joint of the big toe experiences stress when walking and is more prone to inflammation, which also contributes to the crystallization of excess uric acid in it. Stop. But why do some people have normal levels of uric acid in their bodies, while others have an excess that their kidneys can't handle? Where does the excess come from? It's important to understand that the human body doesn't produce uric acid on its own. It arises when purines break down during metabolism. Have you heard of purines before? No. Well, let's get acquainted. Purines are substances present in our bodies that serve a beneficial purpose. Have you ever fueled a fire? It's simple if you have the wood. Purines are like that wood, but for our bodies. They provide energy and contribute to building new cells. Purines are necessary for the body to function properly, just like wood for a campfire. In humans, purines come from food and drinks because they're found in the cells of all living organisms, both animals and plants. Some have more, some have less. Red meat and bacon, red wine and chocolate, mussels and shrimp have the highest purine content. And beer, by the way, is the leader in purine content. The more purines we consume, the more uric acid is formed in the body. So, it's fair to say that people really can eat themselves into gout. However, it's worth noting that gout develops only in the presence of genetic predisposition. Even with identical diets, some people develop gout while others don't. When uric acid crystals accumulate in the joint to a critical level, inflammation begins, triggered by several other factors that are not yet fully understood. Let's pause here for a moment and understand why the body reacts with inflammation. I'll point out that inflammation is a completely natural process. It's a response to the actions of an external or internal terrorist. Everyone has had a splinter at least once in their life. Remember how the area around it turned red, hurt, and became warm? That's the body fighting against the internal terrorist, the splinter. Similarly, the body reacts with inflammation to bacteria, viruses, or infections. Usually, inflammation helps overcome the problem. But uric acid deposition is a terrorist that triggers very intense inflammation in the joint, accompanied by high levels of pain, and thus begins gout, which can lead to joint deformation, disability, and even death. Oh, come on, you might say. You can't die from inflammation of the big toe joint. You're right. Gout doesn't directly threaten life, but it can lead to serious complications, which can indeed be fatal. With improper treatment or no treatment at all, gout can lead to chronic kidney failure, which is a very serious condition. But there's no need to panic because gout doesn't immediately harm the kidneys. The first stage of the disease is acute. During an attack, there's sharp pain in the inflamed joint. The joint literally burns with pain, becomes swollen, and turns red. Then comes the second stage of the disease, the intercritical or inter-attack period, the time between attacks. At this stage, the disease is like a dying ember smoldering slightly. The acute pain subsides, but gout reminds you of its presence with joint dysfunction. This period between attacks can last for months or even years, but gout doesn't go away on its own, and the pain in the toes returns. Attacks occur more and more frequently, and gout progresses to the third stage, chronic, and the fire flares up with renewed vigor. Chronic gout means constant joint pain and deformation. And I'll remind you again, the main cause of all this is the high level of uric acid in the body. And uric acid doesn't just harm the joints. The kidneys suffer too, working to exhaustion trying to eliminate the excess. Plus, an excess of uric acid can lead to the formation of kidney stones and chronic kidney failure. Well, I've already frightened you with that. It's been proven that gout can cause high blood pressure and cardiovascular diseases. Yes, scientifically proven that gout increases the risk of heart attacks and strokes. However, don't rush to throw away meat from your fridge and switch to the green side of vegetarianism. Although it's believed that adherents of plant-based diets with limited or no protein intake are less likely to get gout, it's not always the case. The causes of gout aren't solely related to excessive consumption of purine-rich foods. There are various theories about the onset of gout, including genetic factors, obesity, stress, and even certain medications. Yes, gout can occur even with a proper diet, but in the presence of kidney problems. Remember, the kidneys excrete uric acid. Therefore, if there's a disruption in their function, it can lead to gout, even if you watch what you eat. So when, for some reason, the kidneys can't properly eliminate harmful substances, uric acid isn't excreted. Understand? The relationship between the kidneys and uric acid levels works both ways. When there's too much uric acid in the body, healthy kidneys can't handle its removal, hence gout occurs. If there's a problem with the kidneys, it elevates the level of uric acid, leading to gout. Essentially, the true cause of gout is the elevation of uric acid levels in individuals with a genetic predisposition to gout. But why uric acid levels rise and what causes it? Unfortunately, it's not entirely clear even to doctors. We've covered the reasons. Now I will tell you how to understand if you have gout and how to treat it. Treating gout is essential. But first, you need to be sure that you have gout, not something similar in symptoms, like pseudo-gout. Wait, are there diseases that mimic gout? It turns out, there are. Take valgus, for example. It's not gout, but a foot deformity where the bone enlarges and deviates, causing pain and discomfort when walking. Though it seems like the big toe hurts too. But valgus doesn't occur due to metabolic disorders, but for other reasons, such as flat feet, relaxed ligaments, injuries, or prolonged wearing of tight shoes. Valgus and gout are different conditions that cannot transition into each other. Among other diseases that mimic gout and have similar symptoms, I'll mention rheumatoid arthritis, osteoarthritis, septic arthritis, and, of course, the most important, pseudo-gout. Pseudo-gout is a disease that mimics true gout perfectly. Pseudo-gout is also a chronic metabolic disorder where joints become inflamed and painful. But unlike gout, joints accumulate crystals not of uric acid, but of calcium pyrophosphate. It's impossible to distinguish them visually, so the gold standard for diagnosing both gouts is joint aspiration and microscopic examination of the obtained fluid. The diagnosis is precisely made based on the appearance of the crystals, and the first thing you need to do is to have a blood test for uric acid levels. Gout reveals itself with elevated uric acid levels in the blood. The normal uric acid level for everyone is below 360, and the optimal uric acid level is between 200 and 359 for both men and women. And yet, how can you tell if you have gout before visiting a doctor? You can understand this by the main symptoms of the disease. The joint of the big toe hurts and swells, its mobility is impaired, and the skin around it becomes red and warm. During acute arthritis, the symptoms are always pronounced, but the pain temporarily subsides. In chronic gout, the symptoms are less pronounced, but the pain is always present. Remember, I mentioned the 3 stages of the disease. In the final chronic stage, bones grow and subcutaneous nodules called tophi appear. This usually happens 3 to 5 years after the onset of the disease if left untreated. Gout begins with an acute arthritis attack, which usually occurs at night. It's because the uric acid level in the blood reaches its peak at night. This happens because while you sleep, the rate of filtration in the kidneys decreases, and the excretion of uric acid decreases. Moreover, at night, the body temperature drops, and the cold joint is an excellent place for the formation of uric acid crystals, which cause pain attacks. Many factors can provoke a gout attack at night. Drinking too much wine or beer, straining the big toe in tight shoes, or getting chilled can trigger an attack at night. Surgical interventions or viral infections can also cause the first attack. During an attack, a person experiences unbearable pain. Because of the pain syndrome, a person cannot step on the foot. What's more, they can't even move their toe or touch it. It feels like someone is hitting the joint with a hammer, stabbing it with a million needles, clamping the toe with a press and not letting go, or sticking a knife into the joint and twisting it. At such moments, all you want is to relieve the pain. And I will tell you how to do it. Provide complete rest for the foot. Elevate it slightly and apply a warming compress. To relieve pain, you need to reduce inflammation, and compresses do this quite well. Alcohol compress should be applied for at least 6 hours. It relieves pain and helps reduce joint swelling. Mix vodka with water in equal proportions. Soak gauze in it, and wrap the affected joint. Cover with plastic wrap, then a warm covering. A salt compress also helps. Salt absorbs fluid from the tissue, reducing swelling. For the compress, you can use sea salt and clean water. 3 tablespoons of salt per liter of water. Soak gauze. Apply it to the finger, secure it, and leave it on overnight. 6% apple cider vinegar can also be applied to the joint, wrapped in plastic wrap, then insulated, repeating the procedure every 2 days. Vinegar helps eliminate toxins and uric acid. Our channel subscribers also suggest applying an iodine grid to the finger to alleviate pain if you can't make a compress. You can enhance the effect. Dissolve 5 tablets of aspirin in a bottle of iodine and apply it to the joint several times a day. Our subscribers also suggest drinking water with baking soda in the morning. By the way, remember this advice. We'll come back to it later today. I'm sure you understand that the pain will return if you don't normalize metabolism and eliminate the excretion of uric acid from the body. What will help remove the cause of the pain? Diet or medication? Of course, proper therapy contributes to recovery. But you can't do without a diet. No pills or folk remedies will help if you continue to consume purines in the same quantities as before. You'll have to follow a diet with restrictions on fish and meat products and abstain from alcohol. Or switch to a Mediterranean diet, which consists mainly of plant-based foods and healthy fats. Yes, you'll have to forget about kebabs, chocolates, and other delicacies to reduce the intake of purines into the body. It's advisable to eat fractionally and gradually. Eat more fresh fruits and vegetables. Also, lemon water can be used to excrete uric acid. There are no specific proportions. You can prepare it according to your taste. Studies have shown that lemon water reduced uric acid levels when taken daily for 6 weeks. Opinions vary on coffee and tea, but most scientists agree that these drinks do not affect gout, so you can safely drink them. By the way, here's some good news for coffee lovers. Researchers from the University of Vancouver and Harvard Medical School have found that ground coffee can protect against gout. Canadian scientists have confirmed this as well. They conducted research for a whole 12 years and concluded that long-term consumption of coffee reduces the risk of developing gout in men. The risk of gout was 40% lower in men who drank 4 to 5 cups of coffee a day, and 59% lower in those who drank more than 6 cups a day. Researchers concluded that ground coffee can lower uric acid levels. And it's not about caffeine. Dr. Huan Choi believes that coffee contains a range of beneficial substances that affect the body in such a way that when coffee consumption increases, uric acid levels decrease. What else, besides diet, can help the body lower uric acid levels? Medications prescribed by your doctor and proven folk remedies. A healing decoction will help lower uric acid levels and reduce inflammation. Pharmacies sell ready-made blends that should be taken when uric acid levels are high. But you can also make the tea yourself. Brew birch leaves and cranberry leaves in equal proportions. Such a decoction lowers uric acid levels. You can also make tea from black currant leaves, licorice root, and meadowsweet. It has anti-inflammatory effects. Another simple and proven method to reduce uric acid levels is water. Yes, plain water. During an attack, you should drink at least 1.5, preferably 3 liters of water a day. You can add lemon juice to the water. Water doesn't dissolve uric acid. It acts as a carrier, through which uric acid is flushed out of the body. Stop. But can you drink so much water? What about edema? It seems logical that the more you drink, the more water is retained in the body. But that's not the case. This logic doesn't work. What works is a rule. Drink plenty so that there is little water retention in the body. But how does that happen? You see, water is needed to flush out toxins and waste through the kidneys. Without water, the kidneys cannot function. If you drink too little, the body becomes cautious, fearing that water might be cut off for a long time, and it retains fluid in the tissues. That's how edema develops. The less you drink, the more you swell. It's necessary to drink enough water to help the kidneys flush out toxins and waste. The amount of water you drink affects the proper functioning of the lymphatic system, which works in harmony with the kidneys to cleanse the body of everything unnecessary, including uric acid. Imagine that lymph is like sewage water. It collects waste and toxins from your body. And through the lymphatic vessels, lymph moves and carries away waste. Just like water through pipes in sewage, lymphatic vessels pass through the kidneys and help cleanse the body not only of toxins, but also of excess fluid. The lymphatic system doesn't have its own pump like the heart. So, to prevent lymph from stagnating, movement is necessary. Even a simple change of position, like right now, while watching our video, helps the lymph to move. Change your position and let's continue discussing how else you can help the lymphatic system remove excess fluid. This can be done with the help of a washcloth. Combine showering with beneficial self-massage. Perform light massage movements strictly along the lymphatic flow lines. This will activate the movement of fluid in the body and help remove uric acid. But be prepared that the uric acid, which has found a cozy place in the joint of your finger, may not want to leave the body so quickly. Deposits are very difficult to remove, but they can still be dissolved. Urinary acid dissolves well in an alkaline environment. That's why soda baths are just the thing, as soda is a mild alkali capable of effectively neutralizing the acid's effects on the body. Chinese physicians recommend taking hot soda baths regularly in the evenings. For each liter of water, add 9 drops of iodine and 40 spoons of soda. Eastern doctors advise against such procedures during flare-ups or acute attacks, but rather during moments of calm. When the acute pain has subsided and the inflammation has eased, can you do sports? Go to the sauna, dance, or go hiking with gout? Why not? During periods without acute attacks, you can do anything. The only thing restricted with gout is food. Well, not entirely restricted, but as I've mentioned, not everything. Red meats, pork, sausages, hot dogs, ham, red fish, mussels, shrimp, crabs, and squid are strictly off limits. The list of forbidden foods also includes liver, hearts, fat, and all alcoholic beverages. Upset. I understand you very well. But what can you do? On one side of the scale is the feast for the stomach, and on the other side is health and a life without pain. Indeed, life itself. How to treat gout correctly. Correctly means effectively. Modern methods of treating gout involve a comprehensive approach. This includes medication to lower uric acid levels, drugs to normalize kidney function, physiotherapy, and, if necessary, surgical intervention. And here, I would like to remind you that there's one diagnosis, but people are different. There's no one-size-fits-all protocol. Some people find relief with folk remedies and recipes, while others don't. This doesn't mean they don't work. It means you just haven't found your remedy for treating gout, but there are plenty of options to choose from. Among the folk remedies for treating gout are blue or white clay, as well as clay from salt lakes, which is applied to the affected joints. There's also rubbing with butter and medical spirit in proportions of 300 grams to 100 milliliters. You can apply a burdock leaf to the joint. They say it helps too, and the most common advice is treatment with baking soda. This method of treatment is considered one of the most effective. To treat gout, you should prepare a baking soda solution correctly, following the proportions. Add 1/4 teaspoon of regular baking soda to a glass of water and stir. It is recommended to dissolve the soda in hot water, approximately 70 to 80 degrees Celsius. Then cool the solution to 50 degrees and follow this treatment regimen. For 3 days, drink the solution 3 times a day, gradually increasing the amount of soda to half a teaspoon. Then once a day in the morning, drink a glass of water with half a teaspoon of soda on an empty stomach 30 minutes before eating. When taking soda, you may feel slight dizziness and nausea. This is a body's side reaction, and it passes. And for treating the affected joint, apply a compress with baking soda. Mix 2.5 grams of dry soda, slightly less than half a teaspoon, with 5 grams of honey and dry mustard. Apply the mixture to the affected finger. The effect is cumulative, so make these compresses for 10 days. This way, you not only reduce inflammation but also help the body dissolve uric acid deposits. As you can see, there are many ways to treat gout. From a simple iodine mesh on the finger to complex healing decoctions made from a dozen herbs. Which one is yours? Gout will show. I advise you not to ignore the first symptoms of gout. Act immediately. Use a comprehensive approach to treatment, which includes proper nutrition, dissolution of salts, and reduction of uric acid levels. Find what works for you, and gout will retreat.